So my name is Sarah and I'm a paediatrician working in Greater Manchester. And I've spent the last year working with Shared Health Foundation to deliver outreach paediatric clinics for families in temporary accommodation. And we work specifically with people whose health has been impacted by their experiences of poverty. So I've seen firsthand the impact homelessness has on both current health and long-term health. But I've also seen how solution-focused system changes can work to mitigate the impact if we can pull a system together. So firstly, we know there's significant safeguarding concerns being witnessed, and those are things such as violence, drugs and alcohol, and inappropriate relationships of families being placed in accommodation alongside with individuals. So number one, we are calling for the mixing of single people who are homeless being mixed with families in B&Bs to completely cease. And this is safeguarding at crisis level, but we need to do more than just avert things at crisis level. Safeguarding means to prevent impairment to health and development, and we need to look at that as a wider system change. We know that families living in insecure accommodation have very different needs to single homeless individuals, and we need to focus on that because we know that the physical environment a child lives in, as we've heard, can have a really long-term negative impact. So Shared Health has created a list of gold standards that if a family has to go into emergency and temporary accommodation, that there's standards there that mean that the developmental and health needs of children are addressed. And that means access to safe play and learning spaces, access to the ability to provide good nutrition. There should be ability to cook, to provide food that isn't just having to use emergency provision, fast food, instant food, which is already at higher cost and at low nutritional value. And we need to look at some safeguarding and health training for accommodation providers. There are incredible front of house staff out there, some who've saved the lives of children that we've met across Manchester by contacting the right teams, but it shouldn't be ad hoc that that's how they're met, that they should know and understand how to help and support the people that they're meeting. And the other big one is safe sleep provision. So not all children in temporary accommodation are provided with cots if it's age appropriate. And parents co-sleeping in double beds should be a never event for children. And that's evidence-based health prevention. It's not a luxury. We know that that saves lives with safe sleep prevention strategies. So if we have standards in place and we implement and adhere to them, we can mitigate the negative physical and mental health outcomes that incorporate prevention and promotion. And so we've heard how children experiencing homelessness can slip through the gaps of existing provision because of barriers to health and education. But we know that school providers and primary care already have quality support on offer, but it's navigating the system alone for families when they're in a new geographical area and are moved. It's just incredibly challenging. And because of that, we believe that all children experiencing homelessness should be given the same health and education rights as children in corporate parentship. And what that means is there's a duty to deliver health and education with support to a family. And that's written as a provision that has to be actioned, not just that there's a chance that it might be actioned. Families in this state of crisis shouldn't be fighting for school meals or transport help and education support. It's there. They need to be prioritised to be able to get to it. And this enforces the message that the responsibility of these families' wellbeing is all of ours, and that's housing teams, health providers, educators, and the third sector. And we've seen that work if it pulls together. In Manchester, we have a focused care model where we've embedded experienced health practitioners into housing teams, and they can work with a much bigger elastic remit to add stability and advocacy to families. So our practitioners support anything from resolving benefits and debt to booking and sorting child vaccinations, sorting parent health reviews, to attending child safeguarding and school meetings. And our ideal is that no child is in unstable housing, but once they get to a consistent place, they need to continue to be supported to make sure they don't end up back in the loop again. So we need support that crosses localities, crosses services, and follows throughout the homelessness journey. And when we've done this, we've seen improved outcomes in physical and mental health, as well as stability in the social aspects that mean that progress and outcomes can be made. But the most important message here is that in order to have any chance of improving outcomes and provide truly targeted support, we need to know who needs help, when they need it, and where they are. And that means we know the makeup of our families, genders and ages, who they are, where they are. And that means that the data systems have to be in place to allow us to know where they are. So education, health and housing all have their own data systems, but without them talking to each other, we don't know how best to safeguard children. So we ask you today to sign and support a letter to the Secretary of State asking for this notification system that can inform across sectors, across providers to notify when families need support. We've seen it work within Operation Encompass, which was for families who were notified through the education system when they were exposed to domestic violence. And once we knew those vulnerabilities, schools and systems could support. But until that's there and until we have the data, we can't deeper understand and target the right change. Our recommendations are all evidence-based and we desperately need your support to keep pushing the needs of families experiencing homelessness forward. Please help by joining the family-focused temporary accommodation APPG so that we can continue to move forward this agenda at all levels. Thank you very much.